I am a mom to twin micropreemies born at 24 weeks and 1 day. I had what I would consider the best case scenario with my daughter and the worst case scenario with my son. Babies born at 24 weeks are considered to be right on the edge of viability. The average survival rate is like 60 to 70% depending on the NICU, the care that they received prior, and where they deliver. Obviously, those numbers are going to go down if they need to be transferred or if this was an emergent delivery that no one knew was going to happen. Babies born at 24 weeks account for like 6 to 8% of all preterm deliveries, so it's not super common. The average weight is about 1.5 pounds, which is the size of a Coca-Cola can or an adult hand. It's extremely hard to visualize what a tiny baby like this looks like until you see it in person, and I still can't believe that my daughter used to look like that. Like, it's mind-blowing to me. Their eyes are still fused shut or just starting to open. For me, both my kids had their eyes fused shut. Their skin is translucent and extremely fragile, so you can literally like see through their skin. Their lungs are in the saccular stage, which means they're just starting to form like the little tiny air sacs that help them breathe. Obviously, there are exceptions, but nearly 100% of babies born at 24 weeks are either intubated and on a ventilator or have CPAP, and more commonly, they're on the ventilator. When a micropreemie is born, you don't get to hold them. They're swept away by the NICU team if you have one, and they are intubated, they are getting lines, they are just buzzing around this baby to keep them alive. Caffeine therapy is something that I never heard of, but they actually give these little babies caffeine to help increase their respiratory drive. Many of these babies get multiple blood transfusions, so like my son Teddy had 24 and my daughter Vivi had 7. If you can donate blood, donate blood. The average NICU stay is until the baby's due date or a little bit after. For us, we got lucky and my daughter came home about a week before her due date, but she was in the NICU for 101 days. About 70% of these babies do have chronic lung disease for being intubated for so long. About 45% of these babies have intraventricular hemorrhage, which both my children did have, and that's a brain bleed. My son had a grade 4 bilateral brain bleed, and my daughter had grade 2 bilateral brain bleed and a bilateral cerebellar bleed as well, because their brains are literally tissue paper thin when they're born. A lot of these babies end up having ROP, which my daughter did have. She did get laser treatment for it, and it's gone now, but she did have it. Go to part 2.